Welcome to StantonMD. I'm board certified emergency physician Dr. Ryan Stanton. Today we have a great show with information on cosmetic dentistry, the risks of some of the common medical conditions on the eyes, and then we're going to spend more time with Leanne Ripito talking about her battle with opioid and heroin abuse. We've spent some time now talking about your teeth and dental health, but sometimes you just want to clean up that smile a little bit. Cosmetic dentistry is a huge industry, and we spent some time with Justice Dental to talk about some of the tools and technologies to help create that perfect smile. We will then head over to Retina Associates of Kentucky to talk about some of the changes in damage associated with diabetes and high blood pressure. Dr. William Wood will walk us through the risks as well as the tools they use to help diagnose and treat this common presentation before it's too late and vision is permanently impaired or lost altogether. Finally, we were planning on having a little bit of a segment from NASCAR, but that will have to be saved for a later date because we want to make sure that you have as much information as possible on the realities of opioid abuse and the potential for recovery. We'll talk with Leanne Ripito and her family about that struggle. But first, let's talk with Justice Dental about that perfect smile. Cosmetic dentistry is a pretty wide catchment phrase which can include everything from teeth whitening to reconstruction, gum trimming, tooth alignment, and capping. The key here is that there is not one solution. Rather, it's an individual plan based on need, goals, finances, and potential limitations.
Well, cosmetic dentistry, kind of that tagline can be confusing, and I like to say that we try to make all dentistry look really aesthetic that we do. So that involves utilizing a lot of porcelain work and trying to do a lot of the dentistry in all porcelains because the porcelains transmit light better than if you say do traditional dentistry where you're using say a metal reinforcement of a crown or something with porcelain over it, and that blocks light. So as cosmetic dentistry, often people think of as veneers, and we do veneers and we love veneers, but we do what we say porcelain restorations dependent upon what your teeth actually need. So that would just depend on the condition of the tooth and actually how you present. So there's no one type of what we think treatment plan that fits everyone. You know, when someone comes in and says, I think I need veneers, you know, I want to analyze their mouth, look at it, all the information, and kind of determine what teeth might benefit from veneers. Maybe that's not the ideal situation, but whatever we do, we're trying to get a maximally aesthetic outcome.
Many will take things into their own hands at home. There are dozens of options out there for teeth whitening and treatments. The key here is to know the roles, risks, and limitations of over-the-counter therapies. Do these therapies do more harm than good?
A lot of people have those kinds of fears, and it's been proven that there's not real damage to a tooth, a good healthy tooth with bleach. Now, I wouldn't recommend someone who's lost a lot of enamel on their teeth to bleach because you've lost the real protective outer coating with enamel, and dentin is the underlying surface of enamel, and actually dentin has microscopic tubules in the dentin that have little nerve endings. So if bleach is hitting any kind of root surface or that exposed dentin, that's where you can get a lot of sensitivity. And so that's sometimes why people get sensitive. Another reason why people get sensitive is just the dehydration of the tooth. And maybe, you know, a lot of people tend to want to put the bleach on there for a long period of time, and the tooth actually is losing a lot of the hydration of the tooth just from our oral saliva. Anything like that keep our teeth hydrated. But if you cover them up for a long period of time, whether you're wearing trays with bleach or I don't know if white strips, but sometimes you'll get what we call dental hypersensitivity or sensitivity from those bleaches. So I like to tell people you really only want to bleach for about an hour. Some systems are designed for you to be able to sleep in them, and they can be fine, but everybody's teeth sensitivity levels are different, and I would just encourage people who are bleaching to use great sensitivity type toothpastes along with that, or else to seek us instead of trying to do home remedies, because sometimes home remedies aren't going to give you all the answers you need.
One of the biggest steps in cosmetic and reconstructive dentistry is understanding what is currently there and what can be. At Justice Dental, they give you that before and after with their Smile Studio. This studio uses a combination of still photographs and videos to help you understand your needs and potential outcomes based on the treatments that are available.
Right now we're taking a lot of pictures with a actual 35 millimeter camera. It's a digital camera, and we take photographs and we will download those and we'll utilize those. We'll even take a before picture, and then we will image on that picture the after smile. So we'll show you how your smile presents in a photo, and then we'll image the after photo. So this little studio, we're able to capture photographs, and a new thing that we're developing is a digital video recording to actually get video recordings and utilizing the video recording for still shots to be able to even image from a frozen smile of the video recording. But the video recording is great because we can actually watch how you speak. So we're actually seeing the position of your teeth and how you speak with that smile. So it gives us even more information.
One person that has been a beneficiary of the Smile Studio is Tiffany. Dr. Justice walks us through her case.
As you can see, we can actually image for you, which is a real benefit because people get to see what the after will look like. And that's kind of big because it's scary to get your teeth worked on and to have changes. And if you can kind of see what the idea of what you would look like after, it's very helpful. So here's Tiffany before, and Tiffany has some restorations on her anterior teeth that she might want to have changed and just kind of make look a little different. So we're going to give you the after shot, and we're kind of showing you what we can do with her smile design to give an idea of what she looks like before and then after, so that you can see this is actually a more aesthetic from a proportion and dimension standpoint for her smile than what she has now.
Depending on the work, cosmetic dentistry can be quite an investment. Thus, it's important to protect that work when it's done. One of the biggest risks is staining and discoloration.
One of the big things is coffee or tea, and the truth is if it will stain your teeth, it will also stain your restorations. And so I understand once people have made a huge investment in their smile why they would want to drink coffee through a straw, and honestly you will avoid staining by doing that. So that's kind of good. Red wine is also one of those stains, and one of the worst, unfortunately, is smoking.
No longer do you have to live with gaps in that smile. Technology for tooth replacement, whether it's one or all, has advanced significantly. Now, more and more options are available to restore those pearly whites. More StantonMD coming up, so stay tuned.